During the AIDS conference in Munich in 2024, GATE hosted a session called Breaking the Barrier.
The conference theme this year is Put People First, which marks an important acknowledgement that the global HIV response has not always focused on the humanity of the communities impacted by HIV. Too often communities have been treated as statistics, and part of the reason that we have the HIV response we have today, the very robust response, is because of the advocacy of community groups.
It's very important that we teach folks that even though you're an expert in your field, you're not an expert of us. We teach you how to treat us. We are the expert of our own lives.
Our entire team represent the communities that we serve. All of our research priorities are given to us by the community.
I will share with you about how the Tangerine Clinic has operationalized its transgender leadership in healthcare services, research, and policy advocacy. There was also a lack of transgender inclusive care in public health facilities. We started employing trans people as part of the healthcare teams. Right now, 90% of the healthcare providers at the Tangerine Clinic are trans-identified people.
We are the subject matter experts. We are the experts when it comes to our lives' narratives. It's not your job to tell our story. Let us tell our stories, but learn from the lessons that we share.
Why is it so important to include trans people within trans healthcare?
Yes, I think first of all, we are the owner of our own agenda.
Because no one understands the trans population better than trans researchers or trans healthcare providers.
If your provider can relate to you, you're going to feel more comfortable, and it's much easier to disclose the things that are happening in your life. You also don't need to be afraid. There's so many people who hide important parts of themselves when they're in healthcare.
When you're part of a community, you have access to knowledge that comes from lived experiences that no one else has. So because of that reason, you're a lot better at asking the right questions. You're a lot more sensitive when you are in contact with the people that you're working with. And you also prioritize their well-being a lot more.
So yes, it's super important for trans people to be in healthcare and actually leading the conversation.
Right now in Jamaica, the prevalence rate of HIV for trans women in particular is at 54%. Like many countries globally, our healthcare system is fully enveloped with right-wing Christian folks who hold on to their conservative thoughts and feelings. So of course that leads to discrimination for trans and gender non-conforming people. As a trans organization that works so closely with the community, one of our dreams is actually to open a trans-specific health space. How can we make that space really tangible and visible for trans people in Jamaica?
You have the organizations. You need to sit together with trusted providers and build it. You don't need a lot of funding to start with this. You need a safe space. You need to be able to offer the array of services, and people will come. And when they come, it will grow and grow and grow and grow. You know, we now have like over 100,000 visits a year. We started off with just a handful. So, good luck.
Lastly, we believe that transgender-led and transgender-owned approach is the key to the HIV community response for trans community and should be scaled up, expanded, and further sustained. The story that I wanted to share with you was about a trans girl, and the main purpose of the clinic visit was to initiate hormone treatment. And then when we talked to her, she shared with us that she was sexually coerced, and we offered her HIV testing. Her HIV testing result was positive, and on that day we were able to initiate antiretroviral treatment for her. So by integrating gender-affirming care in HIV services would be very effective in linking transgender into HIV and healthcare.